supporting the fighters, admiring the survivors, honoring the taken, and never ever giving up hope. World Cancer Day is an international day marked on 4th February that aims to bring people from all around the world together to raise awareness on cancer prevention. Cancer awareness has become a really important topic in the last 2 to 3 decades. Although there has been numerous advancements in the medical industry, the number of new cancer cases every single year has been gradually increasing. Consequently, even the number of deaths has also increased. However, according to WHO, more than 40% of the number of cancer deaths are preventable. This is why raising an awareness for cancer prevention has become the ultimate goal of numerous health organizations across the planet, and World Cancer Day has come to represent an annual reaffirmation of the importance of this goal. What is cancer? Is it preventable? Is it life-threatening? Its causes and cures? Today we are here with our guest, Dr. Madhu Sairam R, to know all about cancer and to get all our clarifications clear. We welcome you to our show, sir.
Thank you, Tanushree, and thank you to everyone as part of NGP School and Management for inviting me for this program. Thank you.
For the benefit of our audience, I would like to introduce Dr. Madhu Sairam. Dr. Madhu Sairam R is a consultant radiation oncologist working at the Kobe Medical Center and Hospital since August 2012. He graduated from Coimbatore Medical College in March 2007. Sir is trained in performing state-of-the-art techniques in radiotherapy, which include stereotactic radiosurgery and gated radiotherapy. He received his MD in radiotherapy at Barnard Institute of Radiology and Oncology, Madras Medical College, and he was the University Gold Medalist in the year 2011. Dr. Madhu Sairam is a recipient of various awards for the papers he has presented. Dr. Madhu was conferred with Padam Singh Award in 2010 for his paper on assessment of depression among cancer patients. He also won the Young Radiation Oncologist Award in 2013 for his presentation of breast radiotherapy advances. He also received a bronze medal in oral presentation at an international conference. This was for his presentation on the topic Initial Experience with Respiratory Gated Radiotherapy in the Treatment of Patients with Left-Sided Breast Cancer. Sir has also authored a chapter on pathology of lung cancer. His fields of interests are neuro-oncology, GI oncology, breast oncology, and palliative care. He is also currently undergoing research as a principal investigator on hospital-based cancer registry (NCDIR). It's truly an honor to be in conversation with a person of such a rich profile and experience. May I proceed with the question, sir?
Yes, Tanushree.
Sir, we all know that an oncologist is a physician who specializes in treating cancer. We also know that there are various branches of oncology which include medical, surgical, and radiation. Can you please brief us on each of these, sir, and which one are you specializes? So we all know that an oncologist is a physician who specializes in treating cancer. We also know that oncologists specialize in one of the 3 major areas of oncology, which include radiation, surgical, and medical. Could you brief us on each of these, sir, and which one are you specialized in? Could you also tell us a little bit about your institute?
Yes, Tanushree. So, oncology is the study of cancers, and it is by and large, split into 3 different branches called the surgical oncology, medical oncology, and radiation oncology. I am a radiation oncologist. Most of the tumors, cancers that come in the body, if operable, would generally be operated. That is what a surgical oncologist does. Medical oncologist is a doctor who gives special medicines called chemotherapy, which could be specific for certain cancers or could be, generalized chemotherapy. And a radiation oncologist is again a doctor who uses high energy X-rays using very specialized machines called as linear accelerators to deliver radiation. So I am a radiation oncologist, as you've already mentioned in the introduction. Thanks for that. So a radiation oncologist actually is a sort of technical person who uses different gadgets to deliver radiations for patients who have cancer. It could be after the removal of cancer by a surgeon, or it could be after chemotherapy where medical oncologist gives chemo to reduce the size of a tumor and then radiation is given, or sometimes directly radiation alone actually treats several cancers. If you see, roughly 70% of all cancers would at some point require radiation as treatment. So it's not just that 3 different branches exist in oncology. There are several other subspecialties also in oncology, as in a neurosurgeon is somebody who operates on brain tumors, so he would develop as an oncologist. A urologist who generally operates on prostate cancers or bladder cancers could also be an oncologist when he operates on cancer. There is another specialty called nuclear medicine, wherein radioactive material is given orally to treat certain cancers. And those are the specialists who actually do imaging using a specialized scan called as a PET scan. So the field of oncology is quite far and wide, and there are several other specialists also involved in the care of cancer patients.
Okay, that's really fascinating, sir. So the common knowledge about cancer is that it is a disease that results when cellular changes cause the uncontrolled growth and division of cells. So this may result to tumors, impair the immune system, and it prevents the body from functioning regularly. So what actually happens to a person, sir, when they are affected with cancer?
Okay, so most people actually know that cancer is uncontrolled proliferation of cells. So this actually happens when certain genetic mutations happen within normal cells. So there is a normal cell which gets spoiled by certain ways and then becomes a cancer cell. This keeps on growing. There is no stopping it. So once it keeps on growing, it forms a small lumpy thing inside the body. Say, example, it grows in the tongue. It forms a small sort of lump over the tongue. Example, somebody has a presence with an ulcer in the tongue and it looks like a cancer. Then a tissue is actually taken to sample it and then we find that it is cancer. So whichever part of the body is affected by cancer causes certain changes in that particular place. In the early days of increase in size of cancer, there may not be any symptoms at all. So patients could just be walking around normally. So only when the cancer becomes a little big, that it encroaches into the tissues that are nearby, the site where it originates. It also tries to spread through the lymphatic system or the venous system of the body and reaches certain places called the lymph nodes and causes lumps in the lymph nodal regions also. Cancer could also spread to other places in the body like the lung or to other parts like the liver, bone, and also cause symptoms in that place. So cancer originating each different site can give different symptoms, as in a tongue cancer could actually cause lump or an ulcer or cause a swelling in the neck also. Only those cancers that have spread widely in the body cause a lot of changes in the body like loss of appetite, patient losing weight, appearing very malnourished and thin. These are things that happen in advanced states of cancer.
Okay, sir. So we all know that smoking causes cancer. What are the other reasons why a person could develop cancer?
Okay, so this becomes very important for people to know that what causes cancer. So most people have several misconceptions as to what exactly causes cancer. You have rightly mentioned one of the most known factors that actually causes cancer is tobacco. Tobacco consumed in any form is actually harmful to the body. It harms body in several ways, the worst of which would be causing cancer. Tobacco taken in the form of chewable forms like pan or bida, and then smokable forms like cigarettes, BDs, cigars, all of this could actually result in developing cancers. In fact, this is one substance that actually has been proven beyond doubt to be the sole factor that actually causes cancer. But then more important than this is something that people should know. Aging is the most important cause for cancer. People who develop cancer are generally older, and then naturally if somebody is surviving for a longer age, they are at higher risk of developing cancer. So the roughly somebody at above 60 years is always at a risk of developing cancer. There are other reasons also which can lead to cancer. Environmental causes like cement industry, dyeing industry, where certain chemicals when people are around the chemical industries for a long time could probably develop certain cancers. Alcohol to a certain extent induces cancers, especially in stomach, liver, and colorectal cancers. As kids in school, you should actually know that in the world, the third most common cause for cancer at this point is lifestyle, of which the most important thing that people should know is obesity is one reason that causes most cancers. So people who are actually overweight and obese are at high risk of developing malignancies. In women, breast cancer, cancer of the uterus, and several other cancers are linked to obesity. In men, prostate cancer, cancer of the gut, the colonic cancers are generally attributed to obesity. So these are the causes for cancer.
Okay, so there are a lot of myths and misconceptions about cancer. People say that the usage of hair dyes, cell phones, cosmetics, these things could actually lead to cancer. So is it true? And if yes, can you tell us some other common things which could lead to cancer, sir?
Okay. So generally, cancer is perceived as a deadly disease. So people generally go around having these misconceptions, and people who have actually gone through cancers generally try to relate to things that they have done in their life. And there are such misconceptions far and wide, not just in India and in the rural areas. Even people with educated people have these misconceptions. One thing that most parents generally are worried is about use of gadgets, especially cell phone. And even especially after COVID, most kids have taken up to using the cell phones for education. Till date, there has not been concrete proof that cell phone has been linked with any cancers. So that rests the discussion there. Cosmetics, hair dye, and several other chemicals that we use on a regular basis are generally not linked to cancer at this point. There is also a misconception among people who have already developed cancer that consumption of sugar, milk can actually lead to increase in the size of cancer. No, it is not so. High consumption of sugar can lead to obesity, and then people could probably be at risk of developing cancer. But sugar or milk or any of the regular food substances that we actually take are not directly linked to developing cancer. And so is cosmetics, dyes, and other things. They are not actually linked to developing cancer.
Okay, sir. So is cancer genetic, and is it preventable? And at the same time, can you tell us how we can prevent ourselves from ever being affected?
Okay, that's a very difficult question. One, the first thing is that there are at least about 20% of cancers in this world that have been very closely linked to genetics. Genetics, as in the genes that have been transmitted by the parents to the child, resulting in certain cancers. So that's only about 20%. Most of the cancers are actually related to the environment or to other lifestyle changes only. So genetic cancers are definitely there, especially breast cancers, ovarian cancers, and colonic cancers have a very strong genetic predisposition. So most people, when they see that one of their relative has actually been affected with cancer, generally freak out, thinking that the whole family could possibly be at risk. Not all the time it is. Only when the person who has developed cancer actually has a genetic mutation, then the rest of the family could be at risk of developing cancers. That's the first part of the question that you asked. The second thing that you have asked is cancer preventable? Okay. Do you think, Tanushree, any cancers actually preventable?
I don't think so, sir, because in today's world, because of the increase in, like as you said earlier, the lifestyle change, which cannot be, modified right now because of the increase in technology. I don't think cancer is preventable, but we can make, we can try distancing ourselves from certain things which could lead to cancer. Maybe.
Okay, Tanushree, we will see what we have actually learned till now. What would you think is the most important cause for cancer after I spoke about 5 minutes back?
Maybe smoking.
Smoking. So if you think tobacco can actually be avoided, isn't that going to prevent somebody from developing cancer?
Yes, sir, but it all depends on how people, take
perceive it.
Yes.
Yeah. So one, as I mentioned, aging can't be prevented. Everybody is going to age, so that is an unpreventable cancer.
Yes, sir.
Cancer cause. Whereas smoking and use of tobacco is definitely in the hands of the individual.
Yes.
So avoiding the use of tobacco completely can actually prevent person from developing several cancers. But then the specific answer to your question is that there are certain cancers that are definitely preventable. One of which is a cancer that commonly affects women in India called the cervical cancer, or Tamil Sollona Garbapai Vai Puttunoi, which is the most common cancer that affects women, especially in the rural areas in India. So this cancer is caused by a specific virus called as human papilloma virus. So this virus actually stays in the body of the woman for many, many years before which the individual develops cancer. One, this can be detected very early by a very simple test called as pap smear. I'm sure most families have heard this term called as pap smear. Women after the marriage age, if they are on a regular checkup with pap smear every year, could probably detect this cancer very early and probably get rid of this disease at a very, very early stage, or even before it becomes cancer. This cancer can actually be prevented by something called as a human papilloma virus vaccine. This vaccine is administered for young girls between 9 and 16, and if the person takes 3 doses of vaccine, of the HPV vaccine, there is a very good chance that this cancer could actually be prevented. So cervical cancer, which is a very common cancer, is a preventable cancer, just like how we saw with the smoking also. Other thing is that there is a particular virus called as Hepatitis B virus. Have you heard of hepatitis viruses?
I have, sir.
Which part of the body does these hepatitis viruses affect?
I'm not sure about that, sir.
Yeah, it affects the liver.
Okay.
So the hepatitis B and C are viruses that affect the liver, and when it goes into the body, they generally are not expelled out of the individual at all. They just keep on going. So hepatitis B vaccine, if given, prevents such an infection, and by preventing such an infection, we can actually reduce the risk of somebody developing liver cancer. So these are the preventable cancers that we know
of. Okay, sir. So people always think that cancer is like the end of life. So is that true? Like, what do you think about that?
Okay. See, the starting of our talk was about the different fields of treating cancers. Medical oncology, radiation oncology, and surgical oncology. Science has actually developed tremendously over the last 25 to 30 years. And it's made sure that cancer, which is a very bad disease for the mankind, can actually be fought with certain easy tools. So first thing that people have to understand is that cancer is not a death sentence. There are several curative treatments for cancer. Especially if a cancer is detected very early, surgery could be a very good treatment where the patient could get rid of the cancer completely. Radiation in many instances cures cancer. And chemotherapy, which can be added to both surgery and radiation at times, can actually prevent the cancer from coming back. So several cancers, common cancers like the breast cancer, colonic cancers, cervical cancer, and cancers of the head and neck region like the tongue or the throat cancers can actually be effectively cured with the modalities that we have actually discussed. So people should actually give off this idea that cancer is actually incurable. So even if somebody actually comes up with certain advanced cancers, even at those stages, cancer can actually be cured. In those patients, we might probably have to use 2 or 3 different types of treatment to combat this cancer. As in, if somebody has a stage 3 breast cancer, that individual would actually have to undergo surgery, will also require chemotherapy to reduce the risk of recurrence, and will also go through certain radiation as well to completely get rid of the disease. This is called as multimodality treatment.
Okay.
So even in advanced stages, several cancers could actually be cured with multimodality treatment. And you did mention in the introduction something about palliative care.
Yes.
So palliative care and palliative treatment using one of these modalities is treatment for patients who can actually not be cured of cancer, but could actually be given very good quality of life and could lead a normal life even when the cancer cannot be cured in them. So there are several options for somebody who gets diagnosed with cancer.
Feb 4th is World Cancer Day. So what will be your message for the people out there, sir?
So you're asking me to give out a message on the World Cancer Day. Tanushri, do you know that there is a theme for World Cancer Day every year?
Yes, sir. I'm also aware that it is Close the Care Gap for this year.
Correct. So this theme would actually be there for the next 3 years. Close the care gap actually means that people develop cancer. There is a facility for treatment, and bridging the gap between the two is actually closing the care gap. Most people are not even aware that cancers can actually be cured. So to develop awareness and take the individuals affected with cancer to the right people who treat is closing the care gap. So that's the theme for this year. I think it's a wonderful theme because a good awareness among public, among students, among kids would actually improve the care of cancer patients in this country. Most patients have most people in this country actually have a very pessimistic idea about this disease. I think that should be broken, and people should get the idea that this is just another disease which could be cured with certain different treatments that is available for cancer.
Okay, sir. So we all know that chemotherapy is one such technique which can be used to, treat cancer. We also know that it's quite painful to go through this process. So is there any treatment which is not as painful as chemo is, sir?
You're utterly wrong, Tanushri, in telling that chemotherapy is painful. In fact, chemotherapy is just another injection that is given to a patient with cancer. It is like, somebody takes antibiotic for an infection, or somebody takes a multivitamin injection for something. It's just another injection that is given for cancer. While administering this injection, generally patient doesn't feel any pain. Even after administration, the pain is not mainly because of chemotherapy, it's because of multiple reasons. So it is not a painful treatment process. Radiation again does cause several side effects in certain areas of the body, but then is generally not very painful. So one thing we should actually get rid out of our mind is that cancer treatment is not always painful. So, and it is in fact done in the good intention of getting the individual rid of cancer. So it is actually most likely tolerated by people who are strong enough to take it, and it is actually easy to go through also.
Okay, sir. That's something that's really good to know. Yeah. So now, as children, we ought to know the ways to prevent cancer. Now, can you please tell us how we can create a cancer-free world and what, as we children and responsible citizens, should be doing to achieve this goal?
I think the idea of this disease should be given to all children. So knowledge is the first step in eradicating this disease. Secondly, children should definitely be aware of certain habits that they should not be developing during their lifetime, and certain habits that they should actually keep on for their lifetime. So one thing that people should certainly avoid is tobacco, which we've already discussed. Second thing is, we should always stick to the saying, all work and no play makes Jack a dull boy. So playing a lot actually gives opportunity for kids to, fight obesity as a disease. An active and healthy lifestyle prevents several cancers like the breast cancer, the uterine cancer, and the cancers of the gut. So staying very active all through the life, not just during childhood, is very important. So as kids, you have to know that a very healthy and active lifestyle, a well-balanced diet would actually prevent most of the cancers. I think that is the message that I would be giving out to all the kids who are listening and viewing this YouTube video. So prevent obesity and have a very active lifestyle. is the message.
Okay, thank you, sir. I've learned quite a lot today, and I'm sure that our viewers as well have gained a lot of information. Thank you so much, sir.
Thank you so much to all the people who are viewing this YouTube video, and thanks to NGP management, the principal, and Tanushri especially for shooting this video. I hope this was very useful, and as has already been discussed, we will work towards creating a cancer-free world. Thank you.